Hey, it's Dr. Bill with just the tip of urology school talking about urologic trauma. Keep in mind that there's a huge database on urologic trauma, and using the AUA core curriculum as guidelines is just the beginning. If you find yourself doing rotations in a emergency room where there's a level one trauma center, but certainly this is a great place to start. Know that urologic injuries are normally about 90% of the time associated with multi-system trauma. The penis, the testes are physically mobile and not protected by surrounding organs. So it is not uncommon to see isolated injuries to the scrotum, the urethra, and the penile shaft. Upper tract injuries are associated with chest and abdominal trauma. Lower tract injuries are associated with lower abdominal and pelvic trauma. Blunt versus penetrating trauma are all important determinations to make, and will be one of those things that will help guide us all in management. Gross hematuria is usually associated with pelvic fracture when there is a bladder injury involved. Blood at the urethral meatus is associated with urethral injury. Penile fracture is a trauma that is usually associated with sexual activity, whether it's partnered or unpartnered sex. When we talk about imaging, CT scans with contrast to identify the number of functioning kidneys and the function of trauma at kidneys and the ureters. Bladder imaging can be fulfilled with the use of retrograde cystourethograms, and penile fractures can usually be addressed with physical exam and history, but penile ultrasounds and MRI of the penis, when available, certainly is of value. Scrotal ultrasounds are employed to rule out testicular injury. When you look at the specifics identified in the written material, understand that management is based on a number of things, including the stability of the patient, the length of time since injury occurred, any associated organ injuries, the presence or absence of two functioning renal units. When we put this all together, you are clearly not alone in this evaluation. It is a situation where multiple specialties are usually in the mix and making group decisions for management of the patient. Fascinating stuff. Read when you can, and if you find yourself in a situation where you are heavily involved with trauma. Dr. Bill, with just the tip of urology school, working with urologic trauma.